In this video, I will discuss ischemia and infarction. So let's start with ischemia. What is ischemia? How you define ischemia? Ischemia is defined as deficient blood supply to any part of tissue, any part of organ. We know that human body is made up of multiple organs. All the organs are made up of cells. Cell is the functional unit of life. Structural and functional unit of life is cell only. All cells, for vitality, they require energy. Energy means ATP. So all the cells require to synthesize ATP for functionality, for vitality. For the synthesis of ATP, oxygen is required. And for oxygen, the blood supply is must for all the cells, all the tissues, all the organs. But whenever there is deficient blood supply to any part of any tissue relative to its metabolic need, the organ is having ischemia, that tissue, that cell is under ischemia. So ischemia is deficient blood supply to a tissue or a part of tissue. That is ischemia. It can happen due to the cessation of the blood supply. So cessation of the artery supplying to that particular tissue or organ. If there is cessation is there. Now it can be partial, it can be complete. So we can say ischemia is of two types. The partial ischemia in which there is partial obstruction of the artery, and complete ischemia in which there is complete obstruction, sudden complete obstruction of the artery. So that is the definition of ischemia. So ischemia is basically deficient blood supply to any organ or part of organ or a tissue. So what is the etiology? The etiology can be of three types. The causes can be in the heart, the causes can be in the arteries, and the causes can be in the veins. So three type of etiologies are there. Let's talk about heart. If there is cardiac pump failure, inadequate cardiac output resulting from heart block, ventricular arrest or fibrillation, it can result in ischemia. In this diagram, you can see this is a diagram of heart. You can appreciate the four chambers of the heart. Look on the left side. On the left side, you can see this is the left ventricle. Normally, when left ventricle is doing systole, the blood is ejected in aorta. On the left side, this is pure oxygenated blood. So this oxygenated blood via aorta is distributed to all organs of the body. But whenever there is left heart failure, left ventricular failure, left heart failure, the left ventricle is not ejecting the blood. It is not doing the systole with vigorosity. So less blood is coming in aorta or no blood is coming in the aorta. So all the organs of the body receive less blood and they undergo ischemia. So this cause is the cardiac cause. Coming on the causes in the arteries, we divide the causes into three categories. Cardiac causes, the causes in the artery, the causes in the vein. We are done with the cardiac causes. Now coming on the causes in the artery as well as vein. Now causes in the artery as well as vein can be divided into three portions. The intraluminal causes, the causes within the lumen, the cause within the wall of the artery or vein, that is intramural, and extraluminal, the extramural. So three type of causes are there in the artery also, in the vein also. Let's first discuss the causes in the artery. In the artery, the luminal obstruction of the artery can occur. Now, who is causing the luminal obstruction? The luminal obstruction can be caused by thrombosis, by embolism. The obstruction can be caused due to the thickening of the wall of the artery. So, thickening of the wall of the artery can occur in atherosclerosis. There can be vasospasm, there can be hyperemia, there can be polyarthritis nodosa, there can be Berger disease, that is thromboangiitis obliterans, there can be severe vessel wall disease. So any of the cause can lead to intramural causes of obstruction of the artery. Now coming on extramural causes, that is the cause of obstruction is outside the artery. It can be some ligature which is obstructing, which is compressing the artery. It can be some tourniquet while measuring blood pressure or some tourniquet. It can be tight plaster, bandages or torsion. So anything from outside obstructing the artery can lead to extramural causes. So let me draw an artery. This is the diagram of an artery. You can see the wall of the artery. Blood is flowing inside the artery. Now, obstruction can occur at three levels. The first is intraluminal. That can be a thrombus or embolism obstructing the flow of the blood. The second is intramural. You can notice the wall become thickened. So there is some cause in the wall, that is intramural. And the third one is extramural or extraluminal. That is compressing the artery from outside. So the three type of causes we have seen individually what are the causes in the three categories. So that is the causes of obstruction in the artery. Now coming on obstruction in vein. What are the causes of obstruction in vein? Let's again divide into three categories. It can be intraluminal, It can be intramural, it can be extramural. In the intraluminal, again, there can be thrombosis, there can be cavernous sinus thrombosis. In the intramural, there can be varicose vein. And in the extramural, it can be strangulated hernia, it can be intussusception, it can be volvulus. So all these are the causes of obstruction in the vein. So after the causes, let's see adverse effects of ischemia. What are the adverse effects of ischemia? As I've told you, ischemia is decreased blood supply to any organ or tissue. Why blood is required? Blood is required for oxygen. Decreased blood supply means decreased supply of oxygen. So that particular organ or that particular tissue which is receiving deficient blood supply will undergo hypoxia injury. That organ will have hypoxia. Hypoxia means it is the deprivation of oxygen due to deprivation of the blood. Because blood is less, so oxygen is less. Now, hypoxia can be of 4 types. What are the 4 types of hypoxia? This classification is really very important for exams. So, hypoxic hypoxia, anemic hypoxia, it can be stagnant hypoxia, it can be histotoxic hypoxia. So, 4 types of hypoxic injuries occur, that is deprivation of oxygen due to deprivation of blood. Hypoxic hypoxia is due to low oxygen in the arterial blood. Oxygen is low. In anemic hypoxia, oxygen level in the blood is normal. But that transporter of the oxygen, that is hemoglobin, is low. That's known as anemia. That's why it is known as anemic hypoxia. So hemoglobin is low. In stagnant hypoxia, oxygen and hemoglobin both are normal. Neither oxygen is low, neither the transporter of oxygen is low. So here inadequate blood supply to that particular organ. And the last one is histotoxic hypoxia. Here everything is normal. Oxygen is normal, hemoglobin is normal, the blood supply to that particular organ or tissue is normal. Still, the tissue is having hypoxia because the cells are unable to utilize that oxygen from the blood. So it is low oxygen uptake capacity of the cell due to cellular toxicity. So these are the 4 types of hypoxic injury. So let me draw the diagram. You can see here I am drawing an artery. This artery is supplying blood to a tissue or an organ. So let me draw a tissue here. This is the tissue or organ. These are the cells of the tissue or organ. So this is the artery. Now inside the artery, this is the oxygen. This is the oxygen. Oxygen is carried by the transporter hemoglobin. So this is the hemoglobin. So hemoglobin molecule present inside RBC. Inside RBC, hemoglobin is present. That is the transporter of oxygen. Now there can be 4 possibilities. First of all, oxygen is less. Oxygen concentration in the blood is less. Oxygen in the air, atmospheric pressure is less. Second, hemoglobin is less. The third possibility, the blood supply to this tissue or organ is less. And fourth, the cells are under toxicity and they cannot utilize the oxygen. That is, utility of the oxygen is less. So that is the 4 types of hypoxic injury I have drawn in this diagram. The first one, when the atmospheric oxygen is less or arterial blood supply of the oxygen is less, it is known as hypoxic hypoxia. So this one is hypoxic hypoxia where oxygen is less. When hemoglobin is less, it is known as anemic hypoxia. When blood supply to that organ is less, it is known as stagnant hypoxia. And the last one, when the cells or the tissue cannot utilize the oxygen present in the blood, is known as histotoxic hypoxia. So the 4 types of hypoxia you can learn in this diagram. Now, coming on the second adverse effect of ischemia. Ischemia is deprivation of blood. Why blood is required? The first use, the blood is required for the oxygen. The second, it is required for the nutrition. Nutrition of all organ is given via blood, right? So if any organ is not receiving the blood, it is deprivation of blood supply. So nutrition, the organ will have, the cells of that organ will have malnutrition. So malnutrition of the cell due to inadequate blood supply and inadequate nutrient supply, that can happen. And inadequate clearance of the waste. So waste will accumulate. So metabolic waste will accumulate inside the tissue. So these are the 3 adverse effects of ischemia. What are the 3 adverse effects? It is hypoxia, it is deprivation of nutrition and accumulation of waste. Whenever any organ receives less blood, it can undergo hypoxia, that is less oxygen, deprivation of nutrition and accumulation of metabolic waste. The 3 adverse effects of hypoxia. After that, let's discuss the factors determining the severity of ischemic injury. What are the factors? There are 4 factors. The most important is anatomical pattern of arterial blood supply for that particular organ. There are 4 different patterns possible. The first pattern is known as single artery supply. That particular organ or tissue is supplied by single artery without anastomosis. That artery is not performing any anastomosis and there is obstruction in the flow of the blood in that particular artery in which there is no anastomosis. So functionally, these are end arteries. So occlusion will result in ischemic necrosis. Examples are cerebral artery, central artery of the retina, and interlobular arteries of the kidney. These are the two examples under this category, that is the tissue or organ have single artery without anastomosis. The second one is single artery but with rich anastomosis. So there are some organs in human body which have single artery supply but the anastomosis is rich. So what will happen? If blockage of such a vessel happen, it will re-establish the blood supply bypassing the blocked artery because anastomosis is very rich. So infarction is less common in such organs. So what are the examples? The examples are superior mesenteric artery supplying blood to small intestine and inferior mesenteric artery supplying blood to large intestine. So superior and inferior mesenteric artery are the examples under this category, and in this category the infarction is less common. Coming on the third category, it is parallel artery supply. What do you mean by parallel artery supply? So there are some tissues or organs where alternate blood supply is there in case of occlusion of the one. So in case there is occlusion of the one, there is vitality of another blood supply. Examples which comes under this category is blood supply to the brain in the region of circle of Willis and arterial supply of the forearm by radial and ulnar artery. So these are the parallel blood supply. Parallel blood supply. After that, the fourth one is the double blood supply. What is double blood supply? Is the dual blood supply. There are some organs or tissues in human body which have double blood supply. What are the examples? Examples are lungs. Lungs are perfused by bronchial circulation as well as pulmonary circulation. The second example is liver. Liver is supplied by portal circulation from the GIT and also by hepatic blood flow. That is pure blood coming from the aorta and the liver. So that is the dual blood supply. So we have seen there are 4 different patterns possible in the arterial distribution of an organ or a tissue. The first one is single artery without anastomosis. The second is single artery with anastomosis. The third is parallel artery and the fourth is dual artery. So we have seen the examples and consequences in each of them, what will happen when there is obstruction of one of the artery. So coming on the type of the second factor, that was the first factor, that is pattern of blood supply. The second factor of severity of injury is type of tissue. What is the type of the tissue? What is the organ or tissue in which ischemia is there, that is deprivation of blood is there? Now in human body, vulnerability of the organ to ischemia can differ. Various organs can have, some are more susceptible for ischemia, some are less susceptible for ischemia. Let's take an example. There are few organs which are more susceptible for ischemia. For example, brain, that is cerebral artery occlusion, heart, that is myocardial cells, and kidney, that is tubular cells, the PCT cells of the kidney, proximal convoluted tubules. So that is the type of tissue affected. For example, just for example, there is hypoxic injury to the brain. What will happen? If hypoxic injury to the brain continues for 15 seconds, patient become unconscious. If injury continues for 4 minutes, that causes irreversible ischemic damage to the brain. And if it prolongs for 8 minutes, death is inevitable. So patient dies within 8 minutes if ischemic injury to the brain continues for 8 minutes. Brain is very vulnerable or susceptible for ischemic injury. So after that, moving to the third factor, that is rapidity of the development of obstruction. What is the rapidity? If sudden obstruction is there, that can lead to ischemia. But if gradual obstruction is there, that can lead time for the formation of collaterals. So ischemia is less common. So ischemia is more common in sudden obstruction. Ischemia is less common in gradual or chronic obstruction. Because in gradual or chronic obstruction, the organ or tissue gets time to develop collateral. So that is the rapidity of the development. The fourth one is the degree of occlusion. Occlusion is complete or partial. Complete obstruction leads to more ischemic injury as compared to partial. Because in complete, we can understand there is sudden obstruction of complete blood supply. But in partial, at least partial, some percentage of blood supply is still maintained for that tissue. So in complete, ischemia chances are more as compared to partial. So we have seen the 4 factors which decide the severity of infarction, of ischemia. Coming on the effects of ischemia. Now it depends. If ischemia occurs in such an organ where collateral channels developed adequately, like anastomosis or collaterals developed, so no effects will be seen on the tissue. If ischemia is occurring in such an organ where collaterals are able to supply the blood during normal activity but unable to supply the blood during exertion, so such organs will have functional disturbances. Now there are some organs in which partial or complete cellular changes will take place because collaterals are unable to form. So under partial changes, there can be cloudy swelling of the change of the cell, fatty change, and ischemic atrophy. But in complete, it can be infarction. And the fourth is sudden death. Sometimes in heart and brain, The two organs which are very vulnerable for ischemia, they will directly, the cells of these organs undergo cell death. So it can range from no effect till cell death. Either there can be no effect on the cell, or it can be as mild as that, and it can be as severe as that. It can suddenly cause sudden death of that particular cell, of that organ. So that's all about ischemia. Let's start infarction. What is infarction? How you will define infarction? What is infarction? Infarction is an infarcted area. What is an infarcted area? An infarct is an area of coagulative necrosis. Now we know there are 5 types of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, and fat necrosis. Now out of these 5 necrosis, whenever any organ or tissue or cell do not receive blood, in absence of oxygenated blood, the necrosis which happens in that particular tissue is ischemic necrosis, or it is known as coagulative necrosis. So the coagulative necrosis, the area in which coagulative necrosis or ischemic necrosis is taking place because of the occlusion of either artery or venous drainage, that area is known as infarct. So basically infarct is a dead area having a group of dead cells. Infarct area is a necrotic area in which coagulative necrosis already taken place. Ischemia is deprivation of blood. Due to deprivation of blood, a particular group of cells is undergoing death, that is necrosis, and that area is known as infarction. So we can say that ischemia leads to infarction. The two topics in this video, ischemia and infarction. Ischemia is deprivation of blood, and due to deprivation of blood to particular cell or tissue or organ, that particular cell, tissue or organ, the cells inside that will die. That is a necrotic area will be formed. The necrotic area which is formed is infarction. So ischemia leads to infarction. Infarction is coagulative necrosis. So that is infarction. What is the etiology? It can happen due to interruption in the arterial supply. It can happen due to interruption in the venous supply. Arterial supply is more common. Interruption in the arterial supply. Coming on the types of infarct, we can classify infarcts based on 3 categories. The first based on their color. The second based on their age. The third based on their whether they are infected or non-infected. So let me tell you 3 types of classification of the infarct. Start with color. Based on color, infarcts are of 2 types. The pale infarct or anemic infarct, and the red infarct or hemorrhagic infarct. As I have told you, infarct can occur due to arterial obstruction as well as venous obstruction. So if infarcts are occurring due to arterial obstruction, it is known as pale or anemic infarct. And if infarct is occurring due to venous obstruction, it is known as red or hemorrhagic infarct. Also in pulmonary artery, it will be red or hemorrhagic infarct. The pale anemic infarct are seen in solid organs, compact organs. The red or hemorrhagic infarct are seen in loose tissues. So you can understand the thing like this. Let me draw a diagram. You can see an organ here. The blood supply to this organ, this is the artery containing pure blood to this organ, and this is the vein carrying impure or deoxygenated blood away from this organ. And this is the flow of the blood in the artery and in the vein. You can see. Now, if obstruction is occurring in the artery, what will happen? This organ will receive less of the oxygenated blood, pure blood. So the organ will look white or pale because of less blood. Such an infarct, the infarct developed in the organ will be pale or white infarct. It is due to arterial obstruction. But imagine if the obstruction is in the vein. So normal blood is coming via artery, pure blood is coming via artery, and that is converted into deoxygenated blood by utilization of the oxygen and nutrients. Now deoxygenated blood cannot leave the organ. It is getting accumulated in the organ. So deoxygenated blood is accumulated inside the organ. That's why it will look red in color. That's why venous obstruction leads to red or hemorrhagic infarct. So that is the reason. Now, based on the age, infarcts are of 2 types, the fresh or healthy infarct and old or healed infarct. Based on whether infected or non-infected, infarcts are of 2 types, bland are free of infection and septic are infected one. So we classified infarct based on 3 categories. Based on their color, they are pale and they are red or hemorrhagic. Based on their age, they are fresh, recent, or they are old and healed. Based on whether they are infected or non-infected, they are bland or they are septic. So this is the 3 type of classification. Now the first type of classification is most important, red infarct and white infarct. I've already told you that red infarct occurs due to arterial occlusion, and white infarct occurs due to arterial obstruction, and red infarct occurs due to venous obstruction. In white infarct, the solid organs are there, heart, kidney, spleen. In red infarct, the soft organs are there like lung, small intestine. In white infarct, well-defined margins are there and progressively paler with time. In red infarct, ill-defined hemorrhagic borders are there and color changes to brown gradually. Edema usually present in venous or red infarct, and it is absent in arterial or white infarct. So these are the differences. In this diagram, you can see a diagram of the lung, and you can appreciate the red infarct here. So loose tissues have red infarct. In this diagram, you can appreciate a kidney. This is the hilum of the kidney, and you can appreciate a pale infarct here. A pale infarct or a white infarct in the kidney you can appreciate. So this is a solid organ where a pale infarct is there. Here also in the spleen, you can appreciate a pale infarct, a pale or a white infarct. So we have seen that in soft tissue like lung, intestine, red infarct is there, and in solid organs like in kidney, in spleen, the pale infarct or white infarct is there. Now coming on the gross of the infarct. The gross of the infarct. If we talk about the gross of the infarct, what is the shape? The shape of the infarct is wedge shape. So wedge have a apex, have a base. The apex is towards the occluded artery and the base is towards the surface of the organ. So this is the example. This is the diagram. You can appreciate the wedge shape pale infarct. This is a diagram of the kidney. In this diagram of the kidney, you can see this is the hilum, and you can see this is the renal artery in the hilum. This is the renal artery supplying blood, which is obstructed here. So this is the infarcted area, which is wedge shaped. See, the apex is towards the artery and the base is towards the organ. So that is wedge shaped infarct, the gross finding. Coming on microscopy. The microscopy is always coagulative necrosis. The coagulative necrosis will be there. In all organs, it is coagulative necrosis, but in brain, it is liquefactive necrosis. So brain is the exception. In any organ or tissue in human body, if blood supply is obstructed, it leads to coagulative necrosis. But if the blood supply to the brain is obstructed, it leads to liquefactive necrosis. In this diagram, you can see this is coagulative necrosis. On this side, you can see a viable kidney. On this side, you can see a necrotic kidney. So this is a diagram of renal tissue or kidney. In the viable kidney, we can appreciate the viable cells in the glomerulus, the viable cells in the tubules. But in necrotic kidney, we can appreciate only outlines are maintained, but cytoplasmic and nuclear details are lost. That is, this is the definition of coagulative necrosis. Coagulative necrosis is known as tombstone appearance or ghost appearance. That is, only architecture or outlines are maintained, but cytoplasmic and interior details, the nuclear details are lost. So we can see it is a typical diagram showing the coagulative necrosis, and the junction of the both shows inflammatory infiltrate. So this can happen in any of the human body organ except brain. Here also in this diagram, the same diagram. This is viable renal tissue, this is necrotic renal tissue, and the junction is showing inflammation. This is the diagram of liquefactive necrosis which occurs in brain. So in this diagram, you can appreciate this is the normal healthy brain, and this is the necrotic brain. And at the junction of the two, inflammation is there, that is the granulation tissue. So this is liquefactive necrosis. Now in contrast to coagulative necrosis, here in liquefactive necrosis, you can see the debris are there. Liquefactive debris are there. So no outline is maintained, no architecture is maintained, neither cytoplasmic detail nor cellular detail. So in liquefactive necrosis, all three details are lost. So that is the microscopy. So what is the summary of this session? What we have learned in this session? In this session, we learned two things: ischemia and infarction. Basically, ischemia leads to infarction. Start with ischemia. What we have learned, what is ischemia? Ischemia is deficient blood supply to any tissue or any part or any organ in human body. Deficient blood supply means deficient oxygen. Deficient oxygen means deficient ATP. So the cells of that organ or tissue start dying, showing necrosis, and the necrotic area, the coagulative necrosis, is known as infarct. So cessation of the blood supply may be complete, may be partial. That is ischemia. We have seen what is the cause of the obstruction. What is the cause of the ischemia? There are three causes. The cause can be heart, the cause can be obstruction of artery, the cause can be obstruction of vein. Obstruction of artery and vein can occur at three levels. It can be intraluminal obstruction, it can be intramural obstruction, that is in the wall of artery and vein. It can be extramural, that is outside artery wall and vein, compressing the lumen. So that is the causes. Now see the adverse effect of the ischemia. In the adverse effect of the ischemia, the most important adverse effect is hypoxia. Hypoxia is deprivation of oxygen due to deprivation of blood. There are four types of hypoxia: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Hypoxic hypoxia occurs when oxygen concentration in the arterial blood is low. Anemic hypoxia occurs when oxygen level is normal, but the transporter of oxygen, hemoglobin, is low. That is, patient is anemic. The third one, stagnant hypoxia, occurs when oxygen is normal, the transporter, hemoglobin, is also normal, but the blood supply is inadequate to that particular organ. And histotoxic hypoxia occurs when everything is normal. Oxygen is normal, hemoglobin is normal, blood supply is also normal. Still, the tissue is unable to utilize the oxygen from the blood. So that is, there is cellular toxicity. The uptake of the oxygen cannot take place. That leads to hypoxia known as histotoxic hypoxia. Now, coming on the factors which affect the severity of ischemia, there are 4 factors. The first factor is the anatomical pattern of arterial blood supply of that particular organ. 4 possibilities are there. The organ is supplied by single blood vessel without anastomosis. The organ can be supplied by single blood vessel with anastomosis. The organ can be supplied with parallel 2 blood vessels. And the organ can be supplied by dual blood vessels. In each of them, we have seen the consequences and we have seen the examples of arteries in each of them. The second factor is the type of the tissue. In human bodies, some tissues are more vulnerable for ischemia, some are less vulnerable. Most vulnerable organ or tissue in human body is brain. Second is heart, and third is kidney. So in brain, if at least for 8 minutes blood supply is not there, ischemia is there, it can lead to death of the person. The third factor is the rapidity of the development. If ischemia develops suddenly, there is necrosis. But if it develops chronically or gradually, no ischemia will occur because the organ or tissue gets time for development of the collaterals. The fourth factor is the degree of the obstruction. If obstruction is complete, chances of infarction are more. And if obstruction is incomplete, the chances are less. So we can understand that. Now the next topic we have learned is infarction. We already seen that ischemia leads to infarction. Infarction is a necrotic area. In all body organs, it is coagulative necrosis, but in brain, it is liquefactive necrosis. Brain is the exception. Now, we classified infarction based on 3 categories. Based on color, it is of 2 types, the pale or white or red one, red or hemorrhagic. The pale or white is due to arterial obstruction and pale or red or hemorrhagic is due to venous obstruction. Depending on the age, it can be fresh, it can be old. And depending on the infection, if infection is present, it is septic, and if it is absent, it is bland. Now, the most important is the red and white infarct. Red infarct occurs due to arterial occlusion, or basically arterial occlusion in the loose tissue, or venous occlusion. White infarct occurs due to arterial occlusion. Red infarcts occur in soft tissue. White infarcts occurs in solid organ. Edema is present in red infarct, that is venous obstruction. Edema is absent in white infarction. So that's all about ischemia and infarction.